A very good morning to all of you, and thank you for being here. When I opened my first clinic at the age of 22, later with a loan at 36% interest, people looked at me, a young homeopath, with skepticism. They said, "You need grey hair to prescribe white pills." I wore zero power spectacles just to look older. But I wasn't looking for acceptance because I had belief. A belief that medicine wasn't merely about curing disease, but about healing people. Today, after over 50 years in healthcare, I have learned one thing. You don't need grey hair. You need conviction and compassion. I come from a family of doctors. My father practiced homeopathy, my mother allopathy. I jokingly say that I am a product of mixopathy. Dinner table conversations sounded more like medical conferences. They were often about how to treat patients and reduce their pain and suffering. But when I chose homeopathy, I wasn't choosing tradition. I was choosing conviction. At that time, homeopathy was treated like a relic. People called it outdated, unstructured, a last resort. But I saw something others didn't. I saw the future. I believed that if we brought science, sincerity, and structure to the system, it could lead the world towards a healthier future. And thus began a journey that spanned over 5 decades and taught me lessons I never learnt in medical school. One of those lessons was simple. People don't resist change. They resist discomfort that comes with change. When I computerized my clinic in 1982, one of the first in the world, people laughed. They said, "Why spend so much on a computer when you could hire more doctors with the same amount of money?" The cost of one computer that time was equivalent to hiring 15 MD doctors. But I wanted to do more than just investing in machines. I was investing in a future where care wasn't dependent on memory or illegible handwriting of us doctors. I still remember that my love letters to my wife had to be taken to the chemist to be read. That's why we started electronic medical records over 40 years ago, long before digital health became a buzzword. We built systems that reduced human error, enabled second opinions, and made healthcare about consistency, not chance. Today we use AI, genetic science, and data from all over 1.5 million patients to personalize treatments in a field once considered too soft for science. But it's not just technology which is an enabler or a disruptor. I believe that the real threat to healthcare today is disconnection. We built a system that's quick to prescribe but slow to listen. More tests, fewer questions. More reports, fewer conversations. We treat bodies, we forget to treat people. This is the silent epidemic of our times across hospitals, clinics, and even in our homes. We are so busy fixing symptoms, we forget to heal the human being behind them. And that's the gift homeopathy gave me, the reminder that healing is deeply human. A good doctor listens not just to symptoms, but also to silences. Understands the story behind the illness. Treats not just what's wrong, but why it went wrong. And that principle isn't limited to medicine. Whether you're building a company, raising a family, building a community, real change begins when you treat people, not just problems. I've come to believe that health begins long before a pill is swallowed. It begins in our kitchen, our daily habits, the way we sleep, eat, move, and think. But somewhere along the way, we have lost that balance. We've replaced nourishment with convenience, turned exercise into an occasional event. Sitting, they say, is the new smoking. We've allowed tobacco, sugar, and sedentary living to silently chip away at our future. And we are paying the price. My years of practice has made me realize that healing is not just physical. It's mental, it's emotional. Behind every illness, there is often an untold story of stress, of loneliness, and of fear. Yet we've created a culture where seeking mental health support is seen as weakness. When we tell our parents that we are depressed, they often say, sleep well, tomorrow will be a better day. Anxiety and depression were not recognized earlier. Today, over 200 million Indians suffer from mental health conditions. Less than 30% seek help. That is more a crisis than a gap. And we need to change the way we see it. Not just as a personal flaw, but as a human reality. We live in a world today that's far more connected than ever before. Yet, we have never felt more lonely. We have many followers, but fewer real friends. We are chasing likes, but we forget to like ourselves. Between screens and scrolls, we've stopped pausing and started performing. That's why I tell young people, detox before the screen starts controlling you. Because your potential isn't measured by how fast you scroll, it's defined by how deeply you connect with yourself, with others, and with life. I didn't set out to build a business. I set out to build a healing ecosystem. Healing isn't a profession. It's a way of living. Before I leave you, I want to share something I've learned after all these years as a doctor, an entrepreneur, and as a human being. There are 2 P's that are important to succeed in life. They are passion and purpose. Anything that is done with passion is normally successful. When you believe in yourself, you succeed. कदम चूम लेती है मंजिल आकर, कदम चूम लेती है मंजिल आकर, अगर राही खुद अपनी हिम्मत ना हारे. As they say, लगे रहो मुन्ना भाई. There will always be problems, but you perceive till you succeed. Never give up. When you add purpose to passion, it's सोने पे सुहागा. I've used my hobbies of photography and singing to help raise funds for the visually challenged and old age homes. I strongly believe that companies based on strong values outlast others. I've always believed that my purpose in life is to heal and to leave the world a better place than I was born into. I end with a short poem that my mother used to recite. Life is an echo, all comes back. Life is an echo, all comes back, the good, the false, the true. So give the world the best you have, and the best will come back to you. Thank you.